Welcome to The Incredible Messenger, a blend of real-world stories, expert insights, and proven strategies that keep our families, communities, and cities safe and healthy. Moving beyond rhetoric and politics to practical solutions and community safety, here's your host, Jonathan McMillan.
All right. Good morning, everyone, or good afternoon, or wherever you are when you're listening to this. My name is Jonathan McMillan, and I am the host of the Credible Messenger podcast. And for those of you who are listening, thank you. And I'll even say congratulations. You're listening to the absolute first episode of what I have envisioned as being a platform, a game changer for those who are looking for solutions around gun violence, community violence, and firearm injury death prevention. So I could not be more excited. One of the first people who responded is someone who I have recently just met in person. I've heard about him for a really long time. And you're in the world of community violence intervention. You've probably heard of him, or I know you've heard of his work. It is Norman Kerr, now of Trajectory Change Solutions, but he's actually been one of the people who was behind what we know as community violence intervention. And so, man, thank you. Good morning. Good morning, Norman.
Good morning, Jonathan, and thank you for having me,
brother.
And to be an inaugural guest on your show, I mean, very flattering, and I appreciate it.
Man, again, you have laid some groundwork for what people are attempting to do out here in the world. I've been involved in aspects of community violence intervention before we called it that for a long time, and we've struggled in order to get the recognition that is necessary to make the change. People were dismissive of it, but through your work with Cure Violence, it's been elevated to a whole nother level. With that said, I want to ask you, tell me about your journey. How did you get involved in this work? What got you involved in this work?
Man, it's not one particular thing, honestly. You know, I grew up in Chicago, and Chicago was always synonymous with violence. And that was always something that bothered me. But for those who grew up in Chicago, you're just used to it. You know, that's just the way Chicago is. And when I started moving around more nationally, and that was like the only thing people were talking about, right? Like in the 90s, people talk about two things when I would meet people in other parts of the country or the world. It was like two things. It was Jordan and it was violence. And it was just annoying. That's the things that people associate Chicago with. And Chicago is a great place with great people. But when I was growing up on the north side of Chicago, there was friends, and I tell the story all the time, because there were friends that I looked up to, even my peers, same grade as me, 1 year older, but I looked up to them because they were very charismatic, athletic, artistic, you know, just smart people. And we lost some of them. Mm-hmm. And it just didn't make sense. And I guess subconsciously I kept that with me. And later on, when I had a chance to really get involved in the work, I kind of like fell in my lap a little bit, because when I came out of college, I had a political science degree, and I started working at an insurance company.
Okay.
You know, great job, great benefits, fitness center, free muffins every morning, like all of that, right? And I couldn't even make it through the training program. Mm-hmm. It was like a 6 training program. I probably made it through week 4, and I was like, I can't do this. Mm-hmm. You know, I need to be involved in community, interact with young people. So I quit the job, didn't have another job. And then later I got a job making significantly less money, working with young people, doing prevention and interventions, teaching them skills. Mm-hmm. And that was the start of my journey, really. And that was exactly 30 years ago.
Okay.
This year.
Wow. 30 years ago. Okay. So we're talking about 93. All right.
93.
And that was at least here in Denver. For those who don't know, I'm here in Denver, Colorado. They called that the summer of violence here because we had so many young people just out here wilding, right? The gang stuff had been here in Denver probably 5 or 6 years. When I say gang stuff, like the LA based type gangs,
Yeah.
the Chicago type gangs had started to come to Denver. And so even 31 years ago, that was the year I caught my felony because I was out there in those streets. So I remember the era well. And I'll probably circle back to that. A couple of things. You just brought some questions to mind. Okay, so 30 years you've been doing this. What was the process from, okay, I'm not working this insurance job anymore. I can't do this anymore. I need to be doing what my calling is, if I could call it that, right? How did that evolve into Cure Violence?
Yeah, so when I started working that job, first of all, I didn't even know that work like that existed.
Okay.
Where you could work with young people and help change the trajectory of someone's life, right? I didn't even know that. And then, so this job really, I got lucky getting it. This job 30 years ago was making $17,000, Jonathan. And I was content. I was able to do a couple more jobs, and then I got connected to the work of Irving Spergel, who was this professor researcher that was from New York, but he had a project based in Chicago in Little Village. And the model that he created, a comprehensive gang model, still exists today. It was replicated in 5 sites nationally by Department of Justice, OJJDP. And I ended up getting a job on one of those projects in Illinois. And this was working with those who were in street organizations, basically trying to help them do something different. So it was new work to me. And I grew up around that element, but I was intrigued by it. And there was a lot of Chicago influence. It was a couple hours south of Chicago, but a lot of Chicago influence. And being an outsider, like that was probably the most difficult piece of it, like penetrating that.
Okay.
So it took a while, but I started figuring out ways to engage people. So I used sports, I used basketball. That was like a big draw, a big hook to build relationships. And I just saw a lot. I did a lot of home visits, just kind of seeing what's happening in the homes. It's like the families needed support. It wasn't just the young person, right? The communities needed support. You know, so it's like we disinvest and we neglect communities, but we expect them to thrive.
Right.
It doesn't make sense. And at the time, it didn't even totally make sense to me either. You know, this is like, the more I'm doing this work, the pieces just start coming together, and then I'm like looking at this more comprehensively. So it's been a journey, and one that I constantly learn. It's like I bring a lot to the table, but I get a lot. I get a lot from participants. I get a lot from families, from communities. And my goal is to build on all of that to produce a better product.
I love that you just said that that you're learning constantly, because I aspire to be a constant learner. And sometimes we hear this narrative, like Kendrick had the song "Be Humble," right? And people struggle with what that means. Is, you know, I define humility as the ability to be confident, but also know that you don't know it all, right?
Yes.
And be willing to be coachable, to seek out education, to seek out wisdom, to seek out better strategies. So I love that you said that. So here we are. You're understanding that a more comprehensive approach needs to be taken, that includes the family, that includes community. And you end up doing the work for a really long time, right? So around what year does Cure Violence come along, and what were the beginning stages of that?
Yeah. So I joined what was called the Chicago Project for Violence Prevention. That was the organization, and I was based at the University of Illinois at Chicago. I joined there in 1998, and we launched Ceasefire, which was really an initiative.
Okay.
You know, so that was like the work to reduce shootings and killings in Chicago. We launched that in February of 2000.
Okay.
We started with just doing some responses to shootings. Like we had looked at different models. We had visited Boston. Boston had visited us. So we pulled elements from Boston. So they had like a rapid response. So we wanted to respond to every shooting incident within 48 hours, right?
With how many people were on staff to respond?
Well, on our actual staff that would respond, it was probably less than 5.
Okay.
It was like just a couple. And we were mobilizing community partners to respond with us.
Okay.
And the goal was that we were going to respond to every shooting incident that took place, whether it was a homicide or somebody was grazed by a bullet, right? So we had selected some target zones. You know, we have police beats in Chicago. So we've selected a couple beats that we were going to focus on. One of the beats was probably one of the most violent geographic areas in the country. So we went there and basically did these demonstrations. We did a lot of visuals with like signs, with these stop killing people signs and bumper stickers and all these things. This is when things just started to roll. And my background of being an outreach worker, we started doing that. We started hiring folks to serve as outreach workers very minimally. We had very little money to do it. At that time, the city wasn't thinking about anything like this. I mean, they were doing more of a community policing type of approach, but nothing to do with intervention. And there were some intervention programs in the past, even one that the city had started. You know, it wasn't traditional outreach, but something similar, but it left a bad taste in people's mouths. I mean, government, law enforcement. So when we were talking about, oh, we're going to do outreach, we're going to bring outreach workers on, and some of them come from street life, blah, blah, blah. Oh, people were like, oh, hell no.
Yep.
We ain't doing that. So it took a lot of persistence and just like breaking it down for people to understand people can change. Too, there's a lot of people who have gone to prison and done 20 years for murder, and they ain't on that no more, flat out. They want to see their community better. They feel like they've contributed to the destruction, so they want to contribute to the success of it. And it's worked in other industries. You know, so Dr. Gary Slutkin, who was the executive director of the Chicago Project, which ran Ceasefire, he came from a public health approach. He worked at the World Health Organization and used a similar approach to address AIDS, cholera, TB, different epidemics. So this was really like the start of talking about violence as a public health issue. And when he was doing that, people were like, dude, you're crazy, because they're so used to violence being addressed by law enforcement. So now you're thinking, okay, it's an issue that we should be looking at how we look at other diseases or epidemics. People thought you were trying to make excuses for people who are in the streets. And no, this is just the way it is. This is the impact of it. And if people get the right support, they can change.
You know, this was 98, right? You said 98, right?
So 98, I started, and in 2000 is when we really launched.
Okay, 2000.
Ceasefire. So this is like all of it. Just, you know, from the initiative started in 95 to the next 5 to 10 years, it was really trying to lay the groundwork, trying to get people to buy into it, if you will, which some still haven't bought into it. But it's been a successful model that's been replicated dozens of times.
The part that you just said that some people still haven't bought into it, that was when I was doing the math and asking about the year. That's exactly where I was going with it, is when we talk about a public health approach to prevention and intervention, people still, eyes just kind of glaze over as if this is an innovative idea, but we've been doing it for 20 plus years, right? Coming up on almost 30 years. And it's strange to me that when we talk about a public health approach, I guess it's not strange. I think that the general public and most people don't understand that public safety and law enforcement are part of a public health approach when it comes to violence. And they're partners, is not siloed effort. So I appreciate you bringing that to the forefront. So here we are. We've gone from 95 to 98 to 2000. Between 2000 and 2021, probably, maybe 2020, ceasefire evolves and it morphs into the cure violence model that a lot of people start to latch on to, so to speak. And then you make a decision. And I'm assuming that decision was made out of seeing a need, hearing in your story, your philosophy of service to create trajectory changing solutions. So what was the need that you're feeling with that? And yeah, tell me about it.
So I actually left Cure Violence in 2000. I left full-time in 2009, and then I was doing some consulting with them for a couple of years, focusing more on some international work. So doing some conversations in Canada, Trinidad, Jamaica. And I ended up at a nonprofit where I started a violence intervention and prevention team. So I built a team from scratch. When I started, there was me, and when I left, it was over 100 people on this team.
Oh, that's amazing.
So it was good. The team is still doing the work. I left there and I went to the mayor's office. So I went to the mayor's office for 2 years as the assistant deputy mayor of public safety. So I ran the Office of Violence Reduction, or some folks call it Office of Violence Prevention, but it's the same function. And this was under Mayor Lightfoot. So I did it for a couple of years, which I hadn't worked in government. I'd always worked in nonprofits, so I wanted to get some government experience. Jonathan, I've been very intentional about what I want to do in my work, right? When I just left Cure Violence, I started grad school, and I actually did a clinical degree in social work. I did a master's degree. Very intentional, right? And that was because we were having a conversation one night. We were at a community dinner, and one of the outreach workers said that she was upset with her participant because she got her participant a job and the participant didn't go. So she was like, I'm so upset, I'm so frustrated and then it hit me. I had a participant in the past, the same thing happened. I went to his house every morning at 6 o'clock to pick him up for a week, and he would never come out and made an excuse every day. And I went back the next morning, right? But it hit me that we're not going deep enough.
Mm-hmm.
So people can get a job. He had a job. He interviewed and got the job. People can interview and get a job, but it's like you have to go and maintain it, right?
Mm-hmm.
And you have to retain it. And there's so many factors why they can't retain it. Mental health, family dynamics, all these things that we don't even think about. We're just like, oh, I got a job. I got him a job. He should go. It doesn't work that way. So that motivated me to go to grad school and do work around social work and just understanding individuals and families better, right? So I did a clinical degree, which I said, I'm not even going to be a therapist, but I want to be able to have that clinical lens and just see what really is their driving behavior. Mental health is a big thing that we weren't talking about back then, right? We still don't focus on it enough here. Some groups are starting to do CBT approaches and that type of thing, but it's really an afterthought still.
Mm-hmm.
So that was another piece in my work, in my career, that was very monumental and really contributed a lot to how I think now. So I was at the mayor's office and I was like, I really want to do more national work. I love Chicago and I'm always going to do stuff in Chicago. TCS really came about because I just felt like there's a lot of opportunities to help people understand CVI a little bit better. So kind of my philosophy was the Biden administration has allocated all these dollars for CVI.
Mm-hmm.
And when I was looking around the country about how it's being implemented, half the people that receive the money, probably more than half, don't even know what CVI is.
Mm-hmm.
So how will they even do CVI when they don't know what it is?
Mm-hmm.
The jurisdictions that are getting this money aren't really breaking it down and saying, okay, well, this is CVI. This is the population you should work with, right? CVI is really focused on the highest risk individuals for perpetrating violence or for being victimized. When you look around, CVI implementation, as it's currently being done, is really focused on younger populations, after-school programs, that type of thing. Mostly prevention programs,
Yep.
mentoring programs, Those things are all important. When I talk about these, people think I'm saying, okay, it's an or. No. But if it's CVI dollars specifically for working with the highest risk and intervention to that population, the most violent population, and you're using it for something different, for mentoring programs for 10-year-olds and 12-year-olds, you're not going to see the result of violence dropping because you're not working with the population that's violent.
Right.
Flat out. This is not like an insult to prevention work, but I always explain it like about COVID, right?
Okay.
COVID, you had to go to the population that was infected. Like, this is the group that you go to because you want to get them quarantined and vaccinated so they don't spread the virus.
Exactly.
That's the intervention side of things. Not saying that you don't provide PPEs and messaging.
You wash your hands, you wear your mask, you 6 feet. That's prevention.
You got to do all that. And COVID didn't look at it as prevention or intervention, PPEs or vaccination. It was like, we got to do all of it, right? But with violence, it's like, we fund a lot of prevention. In Chicago, one of our previous mayors put like 36 million in like mentoring programs and didn't have anything for intervention, right? Intervention has been a thing where private groups have to like figure it out on their own, or philanthropy, right? But the city wasn't doing that because their approach was mentoring. And some talk a lot about like youth jobs. All that stuff is good stuff, but that's not the intervention. Especially if you're not doing it for the population that's violent, right? So mentoring would work if you're going to the population that's the most violent and you're mentoring them, or you're providing jobs to the population that's the most violent to give them an alternative, something different, right? But that's not the way things have been done. And the advocacy that, we constantly have to do around CVI, because we want that population, again, that's the most violent, the ones who are shooting. We want them to get touches. Somebody got to be working with them.
So let me ask you a question. You kind of laid out the groundwork of some of the challenges now that there's funding available for CVI, but it's not necessarily being used to, I'm going to use the word fidelity, or to what the true intention of a CVI model is, to fund prevention or to do truly primary and secondary prevention type work. What is something that encourages you about this popularity of CVI and the way that you're seeing it implemented across the country?
I mean, I think more people are learning about CVI. Like, it's definitely a buzzword now. Like, everybody's talking about CVI, right? I'm encouraged by the number of groups that are doing the work. Like, there's more groups than ever before. We're at a place that we've never been at. Like, the numbers of groups that are doing CVI, like real CVI. I think the shift that we have to do is those that are not CVI organizations, for them to understand that there's a role that they can play to support CVI.
Yep.
So they don't have to do CVI. The work that we do has to be connected to CVI. So I'll give you an example. If we're working with the highest risk, we should be pouring into services that support the ecosystem of the highest risk. Their siblings, their parents, their grandparents, like people who are like involved in the life, who are in their lives and influencing them, right? Because you can't just work with one person and not think about all the things that they're being influenced by and impacted by. So they may have an uncle that's still in the streets, or a grandfather that's still in the streets, or a grandmother. But we're just working with that individual thinking we're going to solve some shit when they're in a household where there's so much chaos, until we start going deeper into the household, understanding like what their dynamic is. We're not going to be successful. And then going to the point about the Biden administration allocating this funding, we're going to look back a couple of years from now. Are we going to say, man, violence was trending down? Or are we going to say, well, it didn't have any impact at all. This shit was a waste, right? Here's the thing, Jonathan. A lot of people are saying, okay, well, there's been reductions in communities. Some of that is like the leveling off of COVID. Like we saw a spike during COVID, and now things are leveling off, and then so it's like you're almost back at static, right? So we got to go deeper as far as what contributed to those results, because there's places where there's been results and there's no intervention workers, right? Or very little intervention activity that's happening. So when I hear that there's been reductions, like, I kind of take it with a grain of salt because I want to go a little bit deeper and really see what that looks like. But during COVID, we had massive spikes in communities,
Yes, absolutely. Being on the ground level here in Denver, as soon as we had as everywhere, we had the lockdowns and the mandatory quarantines. Soon as those were released and relaxed, we saw this immediate spike in violence because people were out their houses and all this conflict was building, right? While people were in the house and unsupervised and didn't have whatever was going on. And then you saw that taper off. I mean, somewhat. Even as you mentioned, the recent numbers that were just released in the last week or so saying violence is down, we're still not pre-COVID numbers, right? We may be lower than we were in 2021 and 22,
absolutely.
but we're still above what we were in 2020. So I feel you in that. I want to continue down this path of talking about going deeper and the different strategies that are a part of CVI work and even violence prevention work, or I'm sorry, violence interruption work. What's one strategy that you saw implemented so innovative and so out there that it was like, man, I would never thought of that, or I would never thought that would work?
Well, I'm trying to think of something really specific, but one thing I will say is I think the incorporation of like females as interrupters and outreach workers.
Mm-hmm.
That was something that years ago it was kind of shunned, and it was like, oh, they don't do this work. But I think we've had so many strong female workers who can do this work and engage even males on a different level. I mean, you really just have to be somebody that is really sincere, care about people, persistent. It's like you're not going to take no for an answer. And we have a lot of sisters that are like that, that really have redefined the game. And I think there's opportunities for more women to be involved in this work, not just as line staff, but as leadership, as the field grows. I think that was something that initially we didn't really look to females like that.
Right.
We always wanted like men, brothers who were from the streets, maybe they had a background. But I think we've evolved to acknowledge the work that sisters are doing in this field and the potential for even more work that they can do that's impactful. So it's really about, when we talk about credible messengers, it's really about that voice, right? That people are going to like connect with, listen to, and validate. Their voices are validated, so.
Yeah, it's timely that you mentioned that because actually another interview that I've got lined up is this amazing young lady doing work here in Denver. I met her 3 years ago when I was organizing a youth advisory committee as Denver is building out their violence prevention model. And she's just been amazing. Her commitment, her willingness to be out there with the youth, with her peers, to help inform strategies and stepping up in leadership roles and having honest conversations with politicians and decision makers about what's really happening in the streets. I want to segue as I think about her in kind of circle back to a couple of things you said. You've served in a lot of different roles. And you mentioned something that is very similar to my experience of doing a lot of community work and then going on the other side of the table and inside government, working in the mayor's office. And when it comes to the politics, and I'm talking about not the street politics, the politics of violence reduction, what's the good and what's the bad in your experience?
I mean, the politics is who wants credit for reductions, right? And what we're seeing is that law enforcement in some places, they want to lead CVI work because it will lead to reductions. But it's a different dynamic when law enforcement run it.
Oh.
And I believe that we need law enforcement and we need partnerships, right? But CVI work cannot be led by law enforcement. And we have to be really careful about how law enforcement is involved in it. So I think there's a partnership that exists, but it can't be something that is viewed as law enforcement led or an extension of law enforcement. And that's what we've seen in some places where outreach workers are viewed as like part of law enforcement, or their law enforcement expects them to share information. There's a two-way street of communication. And I believe that there should just be communication from one side, like law enforcement share data, violence trends, things that street outreach should look out for, but you're not going to get return information on individuals or that type of thing. And some law enforcement get it, like many of them get it. There's been leadership that get it. A lot of brass in Chicago got it, and around the country, some of them get it. There's no doubt. But I think for the average law enforcement, they need to understand the bigger picture. Yes, because right away, it's like everybody wants to see reductions. And everybody wants, what we did contributed to those reductions. And again, in the short term, you may see some reductions, but over time, like what is that going to look like based on the relationships that you have? And the minute this is associated with law enforcement, it's done. Like community is not going to, it's like, I always talk about building trust with law enforcement and community. And it's like, yes, some law enforcement have good relationships with community because they follow through on their word, like all these things, right? You could talk to people in communities and there's specific cops that they're like, oh, that's my dude. But overall, as the force, with everything that happens, they're like, we don't really rock with law enforcement like that. But Sergeant McCullough is my guy. You know what I mean? And we have to think about that when we're trying to build our relationships, is that it takes time to do it. It has to be like a lot of consistency with it. And if there's issues that come up, they have to be addressed to the community, And I think about when I was at the mayor's office and we had like officer involved shootings.
Right.
And right away we went into activation mode where we were talking to people, explaining to them like what we knew, like transparency, and talking to a list of different community leaders, clergy, community-based organizations, activists, like all these people that needed to know. Because if they're misinformed or they don't hear your side, then they're going to assume things and they're going to spread whatever they want to spread, right? So it's like we need transparency in building these relationships is the point I'm getting at.
Right.
That has to be something that's consistent. And I feel like community, they don't feel like they get that.
Yeah, I've experienced everything you're talking about. For those of you who aren't watching the actual video here, you cannot see me nodding my head and maybe even going through a moment of PTSD from my time of doing outreach and violence intervention, from the times that, on social media, I had someone go on social media and say that I was a FBI informant because I worked with the city's community violence intervention program, right? The outreach program. And had me come out my character, Norman. I was like, where are you at? I'm pulling up on you. I'm pulling up on you because, and I look back on it now and I could see, if you looked, squinted hard enough, turn your head sideways, you could see, because the program was housed in the Department of Safety, and people could make the connection between, these street outreach guys work for the police department. And they're part of this COINTELPRO program operatives. What they didn't understand is that oftentimes, many times, most days, I'm rolling around with active gang members, armed gang members, taking them to court, taking them to school, taking them to their PO appointments, taking them, picking their moms up and helping the moms find a job. And the last thing I need is that jacket on me that I'm an FBI informant, right? because that then endangers my life, that endangers my family, all of those things. So again, I went down a rabbit hole. Again, you kind of triggered me for a second there. So you know what? That's actually a great way to ask you about, as a pioneer and a forefather in this work of CVI. We ask a lot of our outreach workers or our violence interrupters. Oftentimes, they're not getting paid what they're worth for doing some really impactful, trajectory changing work, some dangerous work, and they don't necessarily take care of themselves the way that keeps them in optimal health, emotional, physical, spiritual, etc. How do you encourage that in the people the CVI workers and violence interrupters? How do you encourage that and make that a part of your program?
I mean, this is something that I really emphasize with leadership, because they're the ones who a lot of times allow it. So most like interrupters and street outreach workers, they will work all the time. And many of them live in the communities where they work. So it's like they come out, they're going to the store, then there's something that they gotta go deal with as soon as they walk out the door. They're like, oh, I was, one of my young guys, something going on with him, I gotta go deal with this, So I really push to the leadership that they have to be more intentional about making sure people are taking time off. Flat out. It's like, if you know that they use their vacation days, sometimes you can't leave it up to them. You got to be like, hey, you got to take a week off.
Okay.
I mean, you know what they're going through. We've had workers who they've lost clients, they lost clients' family members, and they will continue to work until somebody says, hey, go home. And that's how people work at an optimal level, is that they're taking care of themselves. But sometimes we don't automatically do that. Somebody has to tell us. So really instilling in the culture that coworkers got to be checking in with coworkers. Be like, dude, I know you went through this the other night. Sometimes things that their supervisor doesn't even know, right?
Mm-hmm.
But it's like, that because you rocking with them, and it's like, you see that they dealt with something that was very traumatic or had really impacted them,
Mm-hmm.
right? And so we have to be checking in with each other like that. So getting folks to take time off, doing some sort of activity. When I worked in an organization, I mean, we had mapped out certain things that they would do. We would give them gift cards to go bowling, to go to the theater, things that we know they're not going to do it themselves, but it's like if they get something like this, they're be more likely to go do it. That's how you build an optimal workforce, in addition to getting feedback from them, how they're doing, what they need, what are the issues that they're dealing with, like real checking in with them in the one-on-one supervisions, or even in the team meetings, allowing time on the agenda to bring up some of those issues that they're dealing with. It's just the intentionality behind it, as far as really trying to understand what they're dealing with and paying attention.
So let me ask you, on the personal level, what do you do to maintain your balance in the essence of who Norman is in amongst all the challenges and in the stress of leading this work? How do you maintain your optimal spiritual, mental, emotional health?
So I think this may sound crazy to some people, but we have to be selfish. We have to be selfish about what we need for ourselves. I'm probably the example of the person who carves out time to do stuff, very intentional about it. It's like, man, I cook, I like to bake, I sing in a band. I've been singing in a band for 20 years. Like, I've been doing this work for 30 years, and I've been singing in a band for 20 years. Like, there's something to it. It makes me better. It makes me a better person. And it's like, when I'm in my band singing, it just recharges me. Like I can go to work tomorrow, or I can go to work in a couple of days, because I got that feeling that I need to balance me.
So I did not know that about you. I'm not going to put you on the spot and ask you to say nothing this time. What type of music do you sing, man?
So
what type of band is it?
I'm a reggae singer, man. I'm originally from Jamaica, so I do reggae music.
Okay.
And I do a lot of covers. I do originals, but summertime, maybe 3 to 4 shows a month, sometimes once a week. I mean, it's what I need, So people need to identify the things that they love to do, the things that they need, and not being apologetic for doing it.
I love it. I love it. Do you have a personal philosophy that encompasses your vision for the work? Well, actually, you know what? Pause on that question. I'll edit this part out. Where do you see CVI work in violence in 5 years?
Man, well, I think it's going to be, I would love for it to grow, but I think CVI work is so dependent on whatever administration is in.
Mm-hmm.
I think that's going to have an impact on it. I mean, like I said earlier, I love the fact that there's been more CVI organizations and people are just thinking in this way more than we've seen before. So I think that the potential is there to continue it. I think we've seen in some places that philanthropy has stepped up in certain cities to be one of the main funding sources to carry this work, which we're going to continue to need that. Because some government's going to do their thing, but some local governments just don't have the money, and some are still unclear about what CVI is and what this work should be. So part of my goal is to educate more municipalities and jurisdictions around what CVI is and what it should look like, hoping that this will steer how they're implementing these dollars, right? Mm-hmm. Overall, I think I'm the eternal optimist, man. You can't do this work if you're not an optimist. So I think there's going to be a lot of great things happening. This is where we're at right now as far as this is the work, getting people to see this, understand it, still build on this movement, welcoming folks, because I think there's a role for everybody in this, right? Like, again, COVID, everybody was involved in COVID. But with violence, it's limited. Some internal folks limit other groups from getting involved. Some people think it's not their place to get involved. Some people think this is only for law enforcement and street outreach. It can't be just law enforcement and street outreach. It's got to be more folks involved in this. It's like when we looked at COVID wasn't about public health officials and doctors. No, it's like everybody was doing something. Churches, parks, schools, community-based organizations, everybody felt like they could do something around PPE distribution, setting up vaccination sites, whatever, distributing food, like all these things. Mm-hmm. We didn't limit it and say, well, you're not a health professional, you can't be involved. We didn't do that. We said the more the merrier, get involved, we need you. It's an emergency.
All hands on deck.
It's an emergency. But everybody's really lax about it. Oh, it'll work itself out. No, it ain't gonna work itself out.
So, do you think we're going to have to? I mean, I already feel like we're at a crisis point.
We've been at a crisis. We've been at it.
So, what do you think it's going to take for people to have the same sense of urgency and to be able to break down these imaginary silos of we can't all work together in order to come up with a solution? What do you think it's going to take? And I mean that in almost every sense, whether it's community, government, law enforcement, community-based organizations who are arguing between themselves about who does what. Like, how do we start to move past the turf issues and the ego issues and the funding issues and get to a place where it's all hands on deck?
I mean, it's conversations like this, people really promoting like what this is and what it should look like, providing clarity so people can understand. We got to do our due diligence with it still, making sure that we're consistent with the support. Mm-hmm. Right? We can't have starts and stops with the money and with the funding and with the support. It's got to be consistent. And in Chicago, for instance, like we've never seen consistency with funding. Now, the last couple of years, we've had that, but for decades, there was never anything consistent. But it's really conversations, again, building on this movement for people to understand like what this is and what it should be, and building off of examples that have been good. New York has a good example.
Mm-hmm.
Los Angeles has a good example. Los Angeles says it took them 20 years. That's the other thing. So people think this is supposed to happen like in 2 years. Oh, we want to see results in 2 years. What are you talking about?
Yeah.
2 years? 5 years? What? Give me a break.
Yeah.
Give me a break. This is going to take 20, 30 years of consistency and deep investment and persistence. It's like, this ain't going to change in a couple of years. And that's what people keep waiting for it to, oh, well, if you didn't reduce it in 2 years, then your program is ineffective.
Mm-hmm. Mm-hmm.
It's like, people think that about Chicago. Chicago leads the country in homicides every year. We're well aware of that. We got some great stuff that's happening in Chicago. Part of the issue is we're not working at scale.
Yep.
So if there's 21,000 highest risk individuals that have been identified loosely, right? So it could be more. It could be 40,000 or 60,000. Let's just say 21,000. Our programming in Chicago is working with probably about 3,000. So you're not going to see citywide drops in homicide, 25% reductions in homicides if you're only working with a fraction of the population that's the most violent. Again, back to the COVID example. It's like we hit a tipping point because we were working with more people.
Right.
Getting more people vaccinated, right? It's like in 4 years, COVID cost $1.1 trillion. $1.1 trillion, Jonathan. I'm sure at the beginning of COVID in 2019, they said, oh, we're preparing for this. 2020, they said, you know what? We're going to allocate 500 million or $1 billion, right? As the years went on and it was way more complicated and they had to do more contact tracing and all this stuff, nobody said, okay, we're only going to give you this amount. It costs what it costs. It costs 1.1 trillion. Probably needed every bit of it.
Absolutely.
But here, it's like with violence, it's like, well, here's 250,000 and you have 2 years. What the fuck are you talking about? Seriously, what are you talking about? This is a major issue.
That took, let's not ignore the fact that it's taken hundreds of years at this point to create the environment that the violence is a product of. I just personally, I don't think that as a society, as a country, we're willing to admit how much of a role the system that we operate in created these conditions. Yeah. But we're okay with the system, and we're trying to fix bugs, like in a computer like analogy. We're trying to fix bugs that are system generated, but not changing the system. So anyway, look, we're kind of running close on time. I came up with this idea of this segment. I call it "What's the Word?" So it's kind of like word association. If you can, I want you to limit it to 1 or 2 words. But if something speaks to your soul and you're like, oh, I got to expand on this, please feel free. All right. Okay. So I'm going to hit you with a word, and then, or I'll start a phrase and then you finish it. All right.
Okay.
All right. Success is.
Coming.
Community is.
Essential.
The solution to gun violence is.
Man.
This is one that you don't have to use one word.
Yeah, I mean, I'm pausing because I think we know what the solution is,
Okay.
but we're just not doing it. So that's what's frustrating, and that's why it just got me like. And we act like we need to figure out what the problems are, what the solutions are. We already know that. We've known this for a long time. So
a few months ago, I did a keynote, and man, we'll probably talk about this more just as we expand our friendship. But I've come to think that the things that we work to prevent and the violence we work to intervene and interrupt, the system needs that to exist in order to sustain. But that's a whole other conversation. Yeah. All right, next word. All right, one thing I want people to know about Chicago is
incredible place.
Favorite food is
Jamaican food.
Anything in particular?
Ackee and saltfish, rice and peas, curry goat, oxtail, all of it. Grilled chicken. Snapper.
All right. Favorite book?
I like to read books on like enlightenment, Krishnamurti, people like that. But just getting us to really think about our inner selves and how we can do good, So
if I say, hey, Norman, I need something to read, what are you passing me? Or what are you reading?
Probably an Andrew Cohen book on enlightenment. Yeah, real like simple but thoughtful, right? Makes you think. And I mean, you're in the midst of challenges, and we focus so much on the challenges that we don't focus on like the good,
Mm-hmm.
Yeah.
Okay. Favorite form of self-care?
Travel and music.
Are you a hip hop head like me?
Not as much as you.
Okay.
But I look at your wall, like Run DMC, we've talked a lot about hip hop, so I love hip hop. And, I'm partial to like the Jamaican hip hop heads, what I mean? Yeah. It's like Kool Herc and people like that, Chub Rock and Special Ed and, my Jamaican comrades,
yeah,
KRS and all of them, so I love hip hop, but definitely if I had to put my music in order, reggae, house, Chicago house music, and hip hop.
Okay. No, you mentioned Kool Herc. You give me a lot of Kool Herc vibes, and so
well, I'm honored.
You might not have an answer for this, but I'm going to ask: do you have a favorite television show?
Absolutely.
What is it?
It's going to be crazy, but 90 Day Fiance.
What?
Yeah, the show is like interesting.
All right, let's unpack that, because that is the last answer I had ever expected.
Have you ever watched it?
I have not.
Yeah, I know some people are listening going, what? Yeah, I mean, part of it is like the therapist in me, the social worker in me, but just the relationships, how relationships form and how they impact folks, right? But also with this show, it's like the cultural barriers. Right? So there's always like an American and somebody from another country, and you notice how things get lost in translation, right? So it's like a lot of times they can't effectively communicate because the thing that they think they're saying is not what they're actually saying, right? So when I think about that into the context of like how we deal with community, like communication needs to be so clear, right? So there's couples who are at odds because they just can't really communicate. But also the cultural aspects where they're learning about other cultures. Like you're going to the Philippines, you're going to Africa, you're going to, the Caribbean. And a lot of Americans haven't been exposed to like other cultures. Do you know what I mean? So plus it's just funny. It's a lot of it is funny. But it's a good show. I've been like hooked on it. It's actually a show I watch religiously, like sports. Like,
wow.
I record it and watch it.
Well, okay. I'm now going to have to watch it, right? Because you just broke down, I think, 98% of the problems that we have in doing this work is the lack of communication, the lack of
Absolutely.
of wanting to have a cultural understanding of someone else. So I love it. I love it. All right, next question. Favorite movie
Of all time?
or recent, but yeah, all time would be great.
So my favorite movie of all time is Coming to America. Like, no doubt. But I have a very eclectic list. You know, so on my top 3 list or top 5 would be Sound of Music, you know, The Ten Commandments, Color Purple, but Coming to America, hands down, is genius.
Oh yeah, bro, that boy good.
Boy got talent.
If I wasn't doing CVI work, I would be doing what?
I'd want to be an entertainer. I like comedy. I like to do comedy. I like to sing. I like to act. You know, so something like that.
Okay. My why is
people should be able to live their best lives.
Okay. I am
extremely grateful and fortunate.
All right, this is the last one here. My theme song is.
Oh man, I don't even. Ooh. I'm just gonna say it's Bob Marley. Don't worry about a thing.
Okay. That's one of those songs that just moves you.
I mean, I'm looking outside right now and I'm just thinking, rise up this morning, smile with the rising sun. You know what I mean? It's like you get to see another day, right?
Yeah.
We're lucky to be here. We're alive. So at the end of the day, man, shit is gonna be all right, you know?
But, yeah.
We still got to put the work in.
I'm hoping that I could get the licensing so I could have that come in out as you say that as I edit this, right? All right, Norman, this has been incredible. I could not expect this to go any better than it did. You know, to your point about that song, I'm a particular person. And so even I was working late last night working to get everything in place, and then woke up early this morning to do some things. I was having a few technical difficulties. We even had technical difficulties before we jumped on here. But every little thing's going to be all right, you know. And you showing up when you did and being the first person is, I believe, just a sign of what this show is going to be, and I sure appreciate you. With that said, the show is called The Credible Messenger, and as one of the people who personify that title, I want to close this episode out with one last question. What's the one message that you want people who listen to the show, what's the one message that you want to get across to them?
Well, the one message is when it comes to preventing, interrupting, reducing violence, it's like we can't wait for somebody else to do it. Like, we have to do it in whatever way, but some way that we're contributing, right? We can't wait for somebody else to do it. We have to do it.
Awesome. I think that's spot on. And I'm glad you said it. Because hopefully people are going to listen. Brother, again, you have all my gratitude,
Thank you.
All my appreciation.
Thank you, Jonathan, for having me. I look forward to building with you and with those across the country that are in this work currently and those who want to be involved in this work. I'm willing to work with any city, any group that wants to do something. It's like, let's talk. Let's just have conversation.
So how will people reach you in order to get in contact with you and do business with you?
Yeah, so they can go to our website, trajectorychanging.com. The name of the organization is, the company is Trajectory Changing Solutions, but trajectorychanging.com. You can send me an email through that, Norman at trajectorychanging.com. And yeah, so.
You have anything coming up that the people should know about, and we want to send them your way? A show in Chicago, a conference coming up.
I will say this. So the name of my band is iFicial Reggae. It's like official, but with an I. iFicial Reggae, like I, right? But we got nominated for Chicago Music Awards. So yeah, so the voting ends on the 15th of September, and the announcement will be on the 30th of September. So we'll see. But look forward to rocking with you, man, and taking this thing to another level. So.
I appreciate you, brother. All right, y'all. Well, look, that was a great first episode, but we're going to keep aiming for the top. So, hey, please be sure to subscribe and follow and subscribe. I have a few social media websites. I'm still working out the mix right now. I'll probably edit this ending right now, so I'm just going to end the recording.